As annual enrollment time continues on, we continue to make sure to want to spread the message on how important it is to maybe look for the small details and to really make sure that whether it's you or a loved one who's going to be maybe changing the medical team that you trust your healthcare with, that you really pay attention again to those small details. Well, it is our pleasure to welcome back from MyCare Medical and their wonderful team over there, James DeBray, who we've had a chance to check in with several times now. But I love talking with you, James, because you can tell how passionate you are in making sure people are making informed decisions when it's coming to one of their most important, it's their health. I mean, what could be more important?
Absolutely. It's something you can't get back. It's a commodity that you have to have. And as you get older, it becomes more and more important. So one of the things that we're emphasizing this time of year is that as you're choosing where you're going to go for your care, you make sure that they're willing to build a plan that's specific to you. There's no such thing as a care plan that's built for everybody. There's no general care plan. Every care plan needs to be specific to the person that the care plan is for. And so you need to make sure that as you're going in and you're interviewing prospective PCPs, that they are willing to build a plan specific to you. The other piece that you want to make sure is that not only are they building a plan specific to you, that you are a participant in that plan, so that you understand the rhythms of the plan, you understand the commitments to the plan, and you understand whether or not you can actually comply with that plan, because it should be shaped and formed around you specifically, and your compliance is going to be key to it being successful.
Well, and James, I know you realize this too. I mean, there's just so many choices when it comes to healthcare and trying to find one, that's going to be a good team and a good fit for you. What do you think stands out about you and your team in making sure that you are on that same page and that you are really making sure there's that human connection there?
When you go into a clinic, there's a lot of moving parts that have to happen in the background. For instance, if you're transitioning from the waiting room to the exam room to seeing the doctor to your exit is smooth, that means that a lot of things happen very well in the background, and a lot of people are doing a lot of things the right way. Some of the things that you're going to see in our centers is that we have doctors that will actually be in the waiting room before the patient arrives, because they simply don't want the patient to wait on them. So they will be in the waiting room. And so if you think about that nature, that coordination and what happens there, there's a lot of things that have to happen. There are times when patients need more time in the waiting room, more time with the doctor. And when those things happen, we have to coordinate those schedules and make things happen. So there's a lot of moving parts that happen in the background, but it's vitally important. And if you don't feel it and sense it, that means we've done a great job.
Okay. Talk about that first visit and what people should expect when, they come in for that first visit.
Sure. You should expect that there's going to be a comprehensive review of your medical history, that the doctor's going to ask you a lot of questions about what has happened in the past. You can expect a full review of your prescription medications, and you can expect them to ask you about what you're doing from a supplement as well, because they need to know, as they're building that customized plan specifically for you, that they have encompassed everything that you've gone through in the past, and they're encompassing everything you're dealing with right now. And so you want to make sure that they ask a lot of questions, that you give them straightforward and honest answers. And please, if you can, bring your prescription medication the first time through. That's going to give them a lot of information that's going to help them design a care plan for you.
I like that you say ask questions, because this is part of the reason why you're doing so many of these kind of meet and greet, events. That's what you're encouraging people to do, to come out safely and really get kind of a pulse on how you guys operate.
Yes. A lot of times people go to a book and select a PCP based on the picture. We don't want you to do that. We want you to come and meet us. We want to come and get a sense of what we do and how we do it, and our holistic approach to health. So this Saturday on 10/31, we're going to be at the Iglesia Vida Nueva, the Church of New Life, 610 West Tampa Avenue, from 10 to 2. And we'll have some food available for folks, because food insecurity is one of the things that's really pressing on people's minds these days. It relates to their stress levels. It relates to choices they have to make between healthcare and eating, rent and eating. We want to take that one less stress off your mind. Come to us. We'll make sure you get a good meal, and you'll get to meet our doctors and our teams, and you'll have a comfort level about joining our practice.
Yeah, good. Well, again, always so nice to check in with you, James. We really appreciate it, what you're doing for the community. And of course, the website I know is a great place to kind of figure out more. And again, it's an important decision that people are making this time of year. There's the number to call as well. James, thank you so much.
Thank you. We look forward to all the new patients.